Hello. Is that on? My name is Evangeline Caros. I'm the first of the BA students today, and I completed my practicum at the Bloom Group Community Services Society. The Bloom Group is an organization in the downtown east side of Vancouver that provides low-barrier housing solutions aimed at addressing the complex needs of those living in this community. The housing and services provided by the Bloom Group are in the areas of women and children, mental health, adult guardianship, supportive housing, affordable housing, and hospice. My role at the Bloom Group was as Resource Development Coordinator. I worked under the supervision of the Resource Development and Communications Manager to support with grant writing activities. The practicum-based case that I identified was how to write a persuasive donation request letter to donors. The issue became apparent at a meeting with the manager of the Women and Children's Shelter run by the Bloom Group. It was brought up that the cost of housing several new infants and their mothers was eating away at the program budget. This left little room in the budget to cover critical family building activities and outings for all of the parents and children at the shelter. The task was to write a persuasive in-kind donation request letter for baby supplies from corporations and local businesses. The three main things that I learned through this case were, 1, be concise. Donors only really want to know what you want and what exactly they can do to help. They don't have time to read about all of the great things that an organization does, so every part of the letter should be necessary to making the case. 2, use structure, language, and data strategically. The structure should flow in a way that shows legitimacy, provokes emotion, and then ends with what the donor can do to be the hero. Positive language should be used to show that the organization is well managed but could benefit from the support. 3, go back and make it more concise. This really was the key. Keeping the writing short and clear made for a much more powerful and persuasive letter. So here are some things that worked. Being aware of the types of funding and what they entail. Through the program, I had the opportunity to learn about many different kinds of funding available, from small community-based grants to large federal grants, which made it easy for me to understand why an in-kind donation was the most appropriate for this need and what I would be getting into with the task. Another thing that worked well for me was having a good understanding of the cause and effects of health inequity. This case was less about directly supporting the infants and mothers at the shelter and was more about supporting all of the residents through further programming. An understanding of health inequities and the social determinants of health helped me to better understand and communicate the vulnerabilities of families living in shelters and the deep importance of finding a way to provide family bonding activities and family outings. What didn't work so well was discovering that academic writing is not the same thing as persuasive writing. I had been so used to writing about any topic for at least 6 pages that it was hard for me to keep things short and move away from rigid and emotionless writing. Another thing that was a challenge for me was learning that you can't put references into everything. I often found myself wanting to back up every claim with an academic reference, since that was how I was used to writing persuasively. But I had to learn a new way for a new audience. The public health and social policy values that were inherent to my case were political awareness and interprofessional practice. Political awareness was a value that really helped guide me through my practicum, as the ask of asking for money on behalf of someone else is inherently political. Because the case took into consideration populations ranging from vulnerable clients to the funding departments of large corporations, it was critical that I have an understanding of the power structures at play in order to navigate them in a sensitive way. It was also helpful to understand and value the role of interprofessional practice in my case. Having an awareness of the benefits to working collaboratively allowed me to engage meaningfully with other professionals like program staff and donors. I'd like to thank my practicum supervisor, Darius Mays, my professors, my peers, and my family. Thank you.
That's great. I'd like to hire you.
Thank you, Evan. So speaking of being hired, I heard a rumor from a friend of mine that you've discovered what you'd like to do professionally. Is that based on his practicum? Is that so?
Yeah, absolutely. I really found my passion in fundraising and development through this practicum. And I worked for an amazing organization and an amazing practicum supervisor. So I think that really contributed to it. But I think my passion and future lies in fundraising for sure.
Definitely want to hire you.
Thank you.
Actually, one question I'd like to ask. I mean, there's some, if you like, areas or causes that are easier than others. So, the classic one is it's much easier, I think, to fundraise for children's causes as it is to adults. So, how do you think you go about addressing those sort of challenges?
Yeah, a really cool thing about working for the organization that I did, and it had so many different areas of service. It seemed like any grant that I found or researched applied to one of the services. So they had mental health, children, women, Aboriginal, seniors. So I really didn't face that challenge of trying to find the right funding for a particular cause because the organization included so many different areas of funding that it seemed like almost any grant was able to fit somewhere within the organization.
That's good. With that up, yeah.
Thank you for that. You mentioned that the infants and mothers were eating up the budget and that you had to refocus on the programming end of things. And I was just wondering if you could speak to that a little bit more. I'm just curious.
Yeah, so the situation was that there was several new infants and mothers living at the shelter. So the program budget, most of it was having to be reallocated to buying diapers and formula and baby supplies. So there was little room left in the budget for family outings, which are really important. So the donation request was for baby supplies, was to be given baby supplies, but the purpose was more to be able to support the rest of the shelter through programming. That was kind of really the problem. It wasn't that they couldn't afford the baby supplies, is that it was coming out of a budget that was meant to support family building activities at a difficult time for families.
Perfect, thank you.
Are there any other questions? Well, again, thank you very much.
Thank you.